Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
The Boise State Public Radio app. News, music, and more.
Idaho Matters.
Morning Edition.
All things considered.
The Connector.
And more.
And more.
You can take us wherever you go and stay connected. Without it, you're missing out. Download it free.
You can also communicate using the Talk to Us tab.
The Boise State Public Radio app.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. RSV is lingering this year, and it's actually prompting health officials in a lot of states to extend the immunization period. It is Wednesday, which means it's time for our conversation with Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, can you just quickly remind us what RSV is and who is most at risk of getting it?
Yeah, so RSV stands for respiratory syncytial virus, and it's one of the seasonal respiratory viruses. It typically causes a upper respiratory tract infection, but we worry about young children, particularly under the age of 2, and particularly those in their first few months of life, because they can get particularly sick because their airways are very small. It can become very difficult for them to clear secretions and to breathe. And so they are most impacted. This can cause a significant illness for the elderly as well, but we really worry about those newborns.
So, Dr. Pate, do we know why we're seeing RSV activity continue later into the spring? I mean, this is not usual. And what could be driving that shift in this, seasonal pattern?
Yeah, we don't know. We have a lot of various speculation. Typically, RSV takes off in the fall, peaks in the wintertime, and generally is kind of phasing out by this time. We typically vaccinate for it up through the end of March. Here we are a little over a week into April. We still have high levels of this virus nationally and here in Idaho. And it's likely a combination of a lot of factors, temperature, humidity, and probably human activity, as well as just what other viruses is it having to compete with. And of course, we have seen influenza A kind of fizzle out as would be expected. Unfortunately, we still have high levels of influenza B, and so there's a few less viruses that it has to compete with. But we really don't know why. This isn't unheard of; it's just unusual.
So, Dr. Pate, you mentioned that infants are the most at risk. So, how do the immunizations work for babies? Because I had a child that had RSV. He was about, I think, maybe 8 or 9 weeks old. And so when can they get immunized?
Yeah. So one of the strategies that we use, especially in the last couple of years, because we've had all these RSV vaccines and interventions approved in the past several years. So what we do is if a mom is pregnant and the expected due date will mean that this infant will be coming into the RSV season, then one of our easiest measures is just vaccinate the mom, because those antibodies will be passed on to the baby and help protect that baby. The other thing we can do, though, if if the mom isn't vaccinated, or if we don't know whether she's vaccinated, or and she doesn't know, or if we vaccinate, but then something happens that the baby's delivery is moved up and she hasn't had the full 2 weeks to make an immune response, then we have an option of giving that newborn a monoclonal antibody,
Mm.
and that is highly protective. But certainly, if the child is born, say somebody's going to have their child delivered, let's say May or June, then coming up for the next RSV season, that baby can receive the vaccine.
Okay, so let's say you have a newborn or a very young baby right now, and now we've got this extended season of RSV. What should parents be doing then in order to make sure these little ones are protected from RSV, like right now?
Yeah, check. You can check with your obstetrician or the pediatrician to see was the mom vaccinated. If that infant was born, this winter or this up to this early spring, if the mom was vaccinated and the baby is, as far as we know, healthy, there may be nothing else to do. On the other hand, if it appears unclear or that mom did not get vaccinated, then we can still administer that monoclonal antibody. So just check with your pediatrician to see if mom got vaccinated, or if not, if the infant should either receive the vaccine itself or get this monoclonal antibody.
Okay, I want to head down to California now, Dr. Pate, LA County specifically. This is where health officials are seeing flea-borne cases of typhus. And in fact, it's bad enough that folks are being hospitalized. So, first, explain to us what typhus is and why are we seeing flea-borne cases of it?
Yeah, so fleas are the major vector for transmitting this infection. Typhus can come in several different forms, and but it's caused by a rickettsial infection, which is a bacteria. And so what happens is that the fleas carry the bacteria with them. They hitch rides on rats or cats or possums. Sometimes they can be on flying squirrels. Sometimes they can temporarily be on dogs and all. But rats and cats are kind of the two of the biggest threats. And so what happens is that then these fleas can get into areas where they come into contact with the humans because of rat infestations or feral cats that are around, those kind of things. And so people can then get bitten by the fleas, and then that infection can be transmitted. And you're right, it is quite concerning because 90% of the identified cases there have led to people being sick enough to be hospitalized. I'm sure there are other infections we don't know about that were milder, so that 90% may be a little bit overstated, but it's high. It's whatever the rate is, it's definitely very high. And what has been happening is these cases have been increasing since at least 2024. Every year, there's more and more. So obviously, there's some kind of problem there to be dealt with, whether it's rat infestations, whether it's feral cats, whether it's just people are not protecting their own animals with flea treatments. I'm not sure what's at the root of this, but obviously they need to find out and they need to take measures to control this.
So, Dr. Pate, how concerning is it then to see such high hospitalization rates with this?
Yeah, I mean, this is concerning. We do have a good treatment for it because it is a bacteria. We do have a antibiotic that can be used, but the antibiotic that works the best would be one that we could not use in pregnant women. So that would be a challenge. We do have some other options that just tend to not be quite as effective. So this is of concern, and still, even with the available treatment, there are people that because the initial symptoms can be rather characteristic of a lot of things, and as doctors, we don't see typhus every day. Obviously, those
Hmm.
doctors are going to be on high alert today, but early on cases can be missed. Some patients just think they have a virus because we're just talking about being in respiratory virus. They may think they had COVID. They may think they had flu, any number of things. But then, one of the things that we look for that is different about typhus is of the three types, two of them typically do cause a rash over your trunk. And so typically not affecting your palms or soles, but it does cause a rash. And those rashes are far less common with other respiratory type viruses, especially in adults. So that can be the real clue. But yeah, it's very concerning because it has to be recognized and it has to be treated early, or it does lead to deaths. We certainly have people die from this.
So, with that said, Dr. Pate, I mean, this is going on, as we mentioned, in LA County down in Southern California. So, what should people understand really about their actual risk? I mean, especially if, A, you don't live in California and maybe you don't have a pet.
Yeah, I think obviously this is there's something going on locally there. So this is not going to be something where people from that county are hopping on a plane and then infecting other people. It doesn't transmit human to human. So I think if you're not going to LA County itself, you're certainly no reason for you to be on heightened alert. If you are going, and especially if you're like going to a meeting, going someplace where you're going to be indoors and all, I mean, I don't think I would consider yourself at any increased risk. Now, if you told me you were going to go out into some of the areas and go hiking and you weren't going to wear repellent sprays, you weren't going to wear proper clothing, yeah, I mean, there'd be some risk. It's still not going to be real high because we're talking about cases in the hundreds, but it would be more risk in that event. But absent that, even for people that live in LA County, if they are not interacting with strays, if they don't have a rat infestation problem, if they don't have pets or they have pets but they are receiving flea treatment, then yeah, again, not going to be that much risk for them either.
So there's a new survey from the Pew Research Center that's finding that most Americans still turn to healthcare providers for health information, but it's also finding that a lot of folks are relying on social media, they're relying on AI chatbots, and people with similar health experiences, even as half say it can be difficult to know what information to trust. So, Dr. Pate, this new survey finds that 85% of Americans get their health information from healthcare providers. What does that say to you about how the public is navigating health information today?
Well, frankly, I was pleased it was that high. There has been a lot of damage done by the disinformation movement, the anti science movement that we have seen, that greatly saddens me that actually some physicians would engage in. But we've seen it with our the kind of takeover of science at our federal level by people who are definitely taking anti-science approaches and all. So I frankly I worried that it would come out even lower. So I am very gratified by that. I also think that as we see more and more of these instances where frankly, these vaccine preventable illnesses are causing more havoc. We've got the measles situation that is out of control. And I think people can see that and they understand what's changed. And so I think
Mhm.
that is starting to help undermine this disinformation movement. But obviously, the best thing is for people to get information from their doctors. But, the other thing that I very much empathize with is the findings related to people just being confused as to what is a trustworthy site and what do we
Mhm.
do when we're seeing contradictory information. And so obviously, because most people can't run to their doctor with every single question they have, so we do need a way to try to help educate the public about how you find health information and how you evaluate its veracity, and that can certainly be done.
Well, what was interesting, Dr. Pate, as you just mentioned, right? People being confused about information. So even though 85% of Americans said they're still getting their information from their healthcare providers, the study also found that about half of the Americans they surveyed say it is difficult to judge whether health information is accurate. So, what does that also tell you then about, people's perception or perspectives when it comes to public health and frankly all of the available areas where you might get information, but it could be misinformation.
Yeah, well, it tells me several things. One, if people are still trying to find the truth, and so that's awesome. Number two, that while there we have seen a number of areas where the anti-science, the anti-science and disinformation movement has not been successful. One of the things they have been successful in is just creating confusion and having people just unsure. And unfortunately, Jim, I think what a lot of people do when they are unsure is they think that the safest course then is not making a decision to do something,
Mm.
and that is not often the case, that is the safer choice. But you can understand where, without certainty and them not wanting to make the wrong decision, they just don't take action. And this is why, in my discussions with people, I have nothing but empathy and feeling very outraged on behalf of those that have been misled. They are not anti vaxxers. They are people that have been misled. They're trying to do the right thing for their children. And what is incredibly sad is when they are misled and then something seriously happens to their child. And it's just unbearable. So my anger is directed at those who do know better, who are spreading this for their own personal benefit. And so I think that what because we know people still are they are interested in the truth. They do want to know what the correct information is. I think shows like yours is very important. I think that really our state governments should do more to get good information out to the public. And I think that it's going to require even changing the way that we educate children and older children and adults, college and so forth, as to how to do critical thinking, how to assess the credibility and veracity of online information. Because I mean, you're certainly right that more and more people now, they get their information through online sources, podcasts, social media, which terrifies me. But we got to deal with that reality. So let's equip them for how they can better discern whether that information is trustworthy.
So, Dr. Pate, in your opinion, then, if people are encountering conflicting health information, which we know people do, uh, and in fact, in that survey, three quarters of Americans says that this happens to them. So, in your opinion, what is the best way for the average person to figure out what sources they should trust? Because you're right. Even if you have a primary care doctor, I mean, even if you send them a message, let's say in a My Chart or something like that, they might take a day or so to get back to you. And you don't also want to be constantly asking your doctor, questions every single day.
Well, that's right. So I think that, first of all, if you're finding conflicting information, look at the sources. And so compare the two sources. If one source is from a medical professional society or organization. So, for example, the American Academy of Pediatrics, the American Association of Infectious Diseases, the Mayo Clinic, the Cleveland Clinic. If that's one of your sources, then that is the one, unless you've got somebody that you can reach out to, like us or someone else, and ask, then go with that source because they are constantly reevaluating their material. It's peer reviewed, it's updated, and so give that your trust. But certainly, if it's an important issue to you and you're trying to make a decision, I would ask your doctor, or you can write into this show, or you can perhaps you have a neighbor or friend who has expertise in the area, maybe a doctor or a public health worker. So those are some sources, but I think evaluate where these two pieces of conflicting information are coming from and give greater weight to a medical professional association or one of these, prestigious health organizations or your local health system or hospital.
So, Dr. Pate, there is new research out that's showing that the high dose flu vaccine is doing a lot more for older adults than just preventing them from getting the flu. There's a new study out, and what it says is that it found that adults who are 65 and older who received the high dose flu vaccine had about a 55% lower risk of developing Alzheimer's compared to those who just received the standard dose. So, do you know what researchers think might explain this connection?
Yeah, I think there's a growing sense that um, degenerative brain diseases may, at their heart, be infectious diseases. There may be something about prior infections and the resulting brain inflammation that puts you at risk for these conditions. It was just in the past few years that we have made the direct association between Epstein-Barr virus and multiple sclerosis. We just made another virus connection with Parkinson's disease. My guess is based on not only this study, but you'll remember, Gemma, you and I also discussed the fact that if you got the shingles vaccination, that would lower your risk for
Mm-hmm.
dementia. I think the common theme is if you are avoiding these infections or avoiding severe infections, and if you are getting these vaccines, that what you can do is put yourself in a position of less inflammation in and around your brain, which I don't know if it explains all of this in its entirety, but at least it appears that that is a significant factor at putting you at risk for various neurodegenerative conditions and particularly dementia.
And Dr. Pate, we've talked about this before, as you mentioned. And I'm curious then for older adults and their families, what should they know then about the high dose flu vaccine and why it is recommended for people over 65? Because whenever we've talked about the flu vaccine, you've always reminded folks if you're over 65, get this higher dose.
Yeah, I always try to make that point. First of all, because that is a newer recommendation, and so not everybody is aware of that. It's very interesting that one of the primary authors of this study, who is in Houston and a very world-renowned neurodegenerative cognitive specialist, Dr. Paul Schultz, who I know, he said, "Oh my gosh, I didn't even know there was a high dose flu vaccine," and this is his area, and so it just takes a while for everybody to be aware of it, and so I'm going to continue to remind your listeners every flu season. But those of you who are 65 and above, this is an area where you advocate for yourself. When I go in for my flu vaccine, I always confirm with them that I'm getting the high dose or the quadrivalent vaccine in a high dose. And this is it's perfectly fine. It doesn't just because it's high dose, it doesn't cause more side effects or anything. But it obviously it confers additional protection because, as you mentioned in the lead up, the high dose offered a 55% reduction, but that was after their initial study that showed a 40% reduction. And that's when somebody asked Dr. Schultz, well, what about if people took the high dose? And that's when he became aware and said, well, let's look at it. And so for the last few years, they have been looking at it and now just came out with this study showing, yep, you get additional benefit.
So, Dr. Pate, there's some new research that is suggesting that even small amounts of exercise might help people with memory retention. In fact, researchers are finding that just a brief period of aerobic exercise increase what they're calling brain ripples. Okay, so what are brain ripples and why are they important for memory?
Yeah. So these brain ripples, it's a little burst of electrical activity between neurons, which are your nerve cells, that actually is not big enough for you to identify on the other kinds of testing that we have available. And what was important about this was that these brain ripples were occurring in a part of the brain called the hippocampus that we know is very critical for memory, and that burst would occur right after exercise on an exercise bike. So I would not say that this is proof, but this is certainly very suggestive that we're on the right track. And we have for some time now had a lot of evidence to suggest that exercise does play an important role in our cognition and our thinking. Here is some really important information that is very suggestive to the fact that exercise also may be important for our memory, and that maybe we can increase our memory by getting in very short bursts of exercise, but at the right time after getting material that we want to remember. And obviously, this could have importance not only for older folks like me,
Mm-hmm.
but maybe for our kids. Maybe this eventually we get enough evidence that we say, we should change the schedule of our educational programs in elementary school, middle school, high school, college, because maybe this is a way to boost their retention of material that they just got sitting in a class.
So, how much exercise are we talking about to see these possible cognitive benefits? I mean, are we talking, like a short walk? I mean, would that really make a difference? Or you got to, are we talking, an hour and a half a day?
Well, I think we don't have an answer to that question, but in this particular study, it was really just a short burst of putting them on an exercise bike.
Hmm.
So it just seems that you just need to get a little bit of a burst of activity, cardio. There are other studies that what they suggest is not only can you get that benefit from a short burst of just getting up and just doing a few minutes of just kind of get your heart rate going and exercise. But there are other studies that show that you may be even able to get more benefit from those short bursts if you exercise regularly, and then
Hmm.
the impact you get is even greater than if you don't exercise regularly. And I have seen that in people who are more cardiovascularly fit, have a greater muscle mass, that can result in a metabolic change where you produce more of a protein that actually helps develop these neurologic connections. So I think we don't have the answer to your question yet about
Hmm.
ideally how much exercise, what kind, for how long, how often. But I think this is the kind of support that we need to say, hey, it's now worth going. Let's do a different structured study to try to get at those answers.
So, I mean, this goes back to then, I guess, the idea that we've always heard that exercise is good for you, right? Um, but does this research then, Dr. Pate, help explain why, bottom line, physical activity might protect our brains? Because we always hear it's good for your
Well,
heart, right?
right, exactly. And this wasn't so much this particular study you're talking about was not so much a neuroprotective effect, although other studies have in fact suggested that a regular exercise program is neuroprotective. What this study was showing is that what may happen in this case that wasn't expected is that these little ripples that you were referring to, what that may be doing is that the little bit of exercise that preceded it caused this ripple. The ripple, because it was especially happening there where the hippocampus is and some places that the hippocampus connects to, that the theory that results from it is that that electrical activity may be helping us package the memory. So
Mm.
if I were to sit down and try to teach you some algebra, let's say, and you
Hmm.
had some stuff that you needed, we know that your memory how it works is very different. Short-term memory, long-term memory, but key to that long-term memory is can you package it in a way that connects it and then makes it easily retrievable. That's what may be happening here.
There's no amount of exercise that will help me learn algebra, but I appreciate that you think it could. Um,
Oh, I do.
I wa- I want to I want to move on to a new study that's coming out of UCLA. And Dr. Pate, this is describing a blood test that could potentially detect multiple cancers and other diseases early. And they're doing this by analyzing DNA fragments that circulate in our bloodstream. So, how significant is this idea of a single blood test? I mean, that could screen for multiple cancers and other diseases at the same time.
Yeah, this is intriguing. I don't think this is the magic pill, at
Mhm.
least yet. Maybe it's getting us closer there, but this is a innovative twist. So we have known for a very long time that there are certain markers of cancers that we can check in the blood. And sometimes we do this in the diagnostic period. Other times we do it following the diagnosis of cancer to try to measure how that cancer is doing. Perhaps one of the most common and well known would be for men having the PSA tests for prostate cancer. That's just a marker that we can detect in the blood. Now, so we've known about that for a long time, and we have had certain blood tests, they call them liquid biopsies, where we could check for DNA mutations that are sometimes associated with various cancers and conditions. This is very different and clever. What they did is, one thing that we know is that when your cells die, they kind of explode and they will release some very small amounts of DNA into your blood. And so we all have that. Now, and that's called cell-free DNA. And what happens is, in the body's response to either telling DNA to, okay, go ahead and express yourself, make some more proteins, or no, DNA, you need to kind of shut off. There is a biochemical change where the body adds a carbon and 3 hydrogens to it called methylation. And that's what is clever about this. So what they did is they are collecting blood, and then they are kind of identifying this cell-free DNA, and they're looking for methylation patterns, that chemical modification of it, which is much easier and less time-consuming than to find a DNA mutation. And what they are now showing is that when they can identify certain types of methylation, that it is telling them the likelihood that there is a problem from a particular body organ, and whether that be cancer, or in fact, with this process, they've also been able to identify hepatitis and some other conditions like that. And it's not been bad. It's certainly not a perfect test, but first of all, they can get as low as 2% false positives. But as far as detecting if you have the condition, and this is not every cancer, but 55% for an early stage cancer or one of these other conditions, or 63% if they're looking at all stages of it. So it's not ready for prime time, but this is a significant advance. It's a new way to look at it. It could be cheaper, much more cost effective. It could be more practical. We just have to figure out what would be the proper use for this, because we certainly wouldn't want women to start giving up mammograms, or men stop getting prostate checks, those kind of things, just relying on a test like this. But it's a very important step forward.
So before we go to break, Dr. Pate, in your opinion, what still needs to happen then before a test like this could realistically be used in routine medical care?
Yeah, this test was done using people that we know have these conditions and that they've already been diagnosed. Now, they did compare it with some other things, but I think what you would go next is you have to do a broader population study to see really how accurately you can pick these up. What all conditions can you pick up? Which conditions can you not pick up with this? Because we don't want to be having people think, well, if I go out and get this $20 blood test, which somebody will offer, obviously, that then I don't need to go to my doctor and get checked. That would be wrong. And of course, there's many other things like, that are much more common and also serious medical conditions. A test like this isn't going to pick up high blood pressure. It's not going to pick up diabetes, things like that. So I think we have to be very careful that people don't think this is an easy way out. I don't have to go see my doctor and I don't have to get a checkup and so forth.
There are a growing number of doctors who are starting to use AI scribes to record and summarize patient visits. And apparently, this allows clinicians to spend less time typing up notes and more time talking directly with patients. I am curious about your opinion on this. Are there potential benefits of this for both doctors and patients or not?
Oh, absolutely. In fact, my physician uses it, and just in talking with him, it has saved him a tremendous amount of time. The good thing about that is we want our doctors doing the things that only they can do. And so, if there's a different way to be recording the information from the visit so that the doctor is really concentrating on you and looking at you instead of the computer screen and can get through all of that in less time, well, then guess what? That opens up more appointments. And what's the biggest frustration for patients is they call and can't get in for days or weeks. And so
Mhm.
if we can make this more efficient for the doctors and take away things that don't require the doctor specifically to do, then we allow more time for doctors to do the things that only we can do.
So, Dr. Pate, we do know that these AI scribes can sometimes make mistakes or hallucinate information, as it's being called. So, how important is it then for doctors, but also for patients, to review those, visit summaries carefully? Like we always get those after visit summaries whenever one of us in my family goes and sees the doctor.
Yeah, it is important, and you're quite right. The AI can make mistakes. It is getting a whole lot better because it learns as it goes. Um, and so it is getting better. On the other hand, I would also say your listeners will be shocked. Occasionally, I made mistakes when I was recording things. Not having AI do it isn't a fail-safe measure either. I think the point is whenever we're creating important records, we need to be looking them over to make sure that things are correct.
Mhm.
Even before AI scribes, a lot of physicians had people scribes, and especially you probably encountered this if you went to an emergency room where the doctor would be talking to you, but there'd be another person standing off to the side taking it all down.
Mhm.
And same thing, even when that's a person taking, you've got to check it over and make sure that it's right. And so, yes, that is still going to be an issue, but I think it's an issue regardless of who's doing it. And we need to be careful and review records to make sure we've got it as best we can. But patients looking over things can be an additional help.
So I've got less than 2 minutes with you, Dr. Payton. What about the questions about privacy and how patient data might be used to improve AI systems? What should patients understand about their information being handled?
Yeah, I think that first of all, people would be shocked at how many systems are involved in your care already. This is just one more. If you go to a hospital, there's going to be your medical record system. There's going to be a radiology information system. There's going to be a laboratory information system. All of these things connect, but they're typically different systems. When radiologists review x-rays, a lot of times they have a system that records their dictation and puts it into English in a report. And so there's that. So there's a lot of these systems, but there is an obligation on healthcare providers and those organizations to control that information. It's controlled by federal laws and state laws. And I think most providers do a very, very good job. The big risk is hacks, foreign
Mhm.
and other adversaries hacking into things, but we're always constantly improving those systems.
Well, Dr. Pate, as always, want to thank you so much for your time today. We've been talking with Dr. David Pate, former CEO of St. Luke's Health System and the co author of the book, preparing for the next global outbreak. And remember, folks, if you have a public health question for Dr. Pate, you can always send us an email at idahomatters@boisestate.edu. And we will, of course, get those questions to Dr. Pate and hopefully get them answered to you in the next week or so. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. If this podcast has become a part of your routine, can you tap 5 stars and leave us a review? It helps us stand out.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.